be able to talk to you about this other screening tool, which is for alcohol. Okay. And what you scored here is a 7, and that's in the risky range. Are you surprised by that?
Sort of.
Are you?
Yeah. Well, not really, because a few months ago, I had an aunt and an uncle pass away within a few months from each other, and I'm not a big drinker.
Yeah.
I'm really not a big drinker, but that led me to drink, and I don't know why it did, because like I said, I'm not a big drinker.
Right.
I have drank in the past, but as I got older, I really didn't like to drink, because my mom was an alcoholic, my uncles and aunts were alcoholics, numerous of them passed away from that disease, and I didn't like it. I didn't like to drink, but those deaths really hurt me, and I was really mourning for them. I was really grieving for them, and that led me to drink uncontrollably.
Well, so even though it sounds like there's a family history, even though you're not really seeing yourself as much of a drinker, it sounds like there's a family history you've been really aware of in your family that you didn't want to do that. But this loss was something that really
Triggered it.
Yeah, and you ended up drinking quite a bit.
Yeah.
Well, so let me ask you a few things here then. It sounds like when you drink, just a couple of comments here. Usually you drink, it says 3 or 4 drinks. Is that how much when you would drink if you ever did it?
Yes, maybe less, maybe more.
Okay, all right. And then it sounds, this one I think this question says, how often during the last year have you found that you were not able to stop drinking once you'd started? And you said less than monthly. So sometimes that would happen that you...
Oh yes, absolutely.
Okay.
There would be days where I would just wake up in the morning and drink all day long. When the kids came home from school, I'd try to hide it. But my mom knew. My mom doesn't drink anymore. I'm glad to say that.
That's good.
She's a recovering alcoholic.
That's wonderful.
And she knew. I was trying to hide it from her as well, but she knew. Moms always know.
Right.
And I was trying to hide it from the kids. They knew. They just smell it on my breath, But it became uncontrollable at that moment.
Yeah, so you had times where you could control it and other times you couldn't.
Oh, yeah.
Okay. And then one other thing, how often, it looks like never on that one, so we won't ask you that question. Let's talk about that same thing before. Kind of odd. I always think it's kind of odd, but it's really, I think, helpful. Is like, so the benefits for you of drinking when you would drink are what? What did you get from drinking? How did it help you, or how did you feel it benefited you at those times when you would drink?
Just the same as substance abuse. It numbed me. It numbed the pain. It made me forget. It made me forget about the pain.
All right. So another thing that sounds like is a challenge is that it sounds like as the pain comes up, it may be one of the options you would use to numb the pain.
Yes.
And that pain kind of comes and goes for you.
Oh yeah. Yes.
We'll talk about that in a minute too. So what's the downside of drinking for you? Besides, people knowing that you're drinking, you're not hiding it very well.
You forget everything.
You forget everything, and okay, so that's the downside.
Yeah,
you forget
you're
everything as a
overdrinking.
benefit, and then you forget
that's
everything.
odd. No, that's
Yeah.
odd. Odd question, odd answer, right?
Yeah, well, both sides.
You don't want to do anything with yourself. You think you're nothing. You feel like when you have hangovers, for instance, you feel like you're just nothing. You feel like it took the pain away for that little while you were drinking. You forgot about it, but now you have a headache. You woke up the next day with a headache, and you don't remember half the things you did that night or things like that. That's the downside.
Absolutely. So there are things you forget, you don't feel good, you feel sick,
Yeah,
and then of course you're unavailable to people then too, right? That's another thing too.
Yeah, there were times where I had to be drinking all night, and the kids had to get up for school in the morning. My mom would get up with them because I couldn't get up. I had just fell asleep and I was overly drunk.
Wow. So disappointing in not being able to be present for your children.
Oh yeah.
Okay. Right. Well, so then, Andrea, back to confidence, about drinking, because what I'm hearing is that there can be some pain. The pain comes, sometimes you may numb out with substances, alcohol being one. I guess the question I would ask you then is on a confidence scale, 10 being I'm very confident I won't drink, and 1 being I don't have any confidence at all.
Oh, I'm gonna say a 10 on that one.
You're gonna say a 10?
Absolutely.
Oh, what makes you say a 10?
Because I don't like to drink.
Okay.
I don't like it. I had, like I said, I have a lot of family members. My uncle just passed away from the disease, and it crushed me. But I know now that things are gonna happen in life where you're gonna be hurt. People are gonna pass away. That's just the whole way of life,
Right.
And you gotta learn to deal with those things with a pure mind, pure body, pure soul.
Right.
You gotta learn how to deal with those things. And I have dealt with things like that, without using and without drinking. So I know how to.
How? Tell me a little bit about how you've been able to do that without drinking or using.
Well, I pray.
Okay.
I pray and pray and pray for strength, and it works.
Okay.
I pray to God for strength, and you just go on. You just go on with the day you were given. And you gotta learn to be in the now. You gotta learn to deal with things that are here now.
Right.
And oh man, it's hard.
Yeah.
It's very hard. I'm not gonna lie about that, but you'll get through it. We're stronger than we think we are.
Right. Okay. And you've done it before, you said.
Oh yeah.
So you've had experience before of getting through it,
Yes.
through prayer, believing that, this is just this moment.
Mhm.
If I can stay present, I can get through this.
Yeah.
And
It's just
really
a little
believe
hill
it.
you gotta get over.
And you've done it before.
Oh yeah, the little hills, and then sometimes there's gonna be the big hills, where it's gonna be harder to climb up, but once you're up there, it's easier to come down. You just come down, and you're at that level where you're just like, okay, I did this, I made it through this.
So you have that clarity and stuff. Is there anything then, as we sort of start to wrap up today, as you think about this for the future and leaving and saying, I'm confident I won't drink anymore, I've got some ideas, anything that will help you to stay clear then as you leave and say, no more drinking, I'm gonna stay clean, anything else that you can think of that will be helpful to stay on
In
track?
here or out there?
Out there.
Just having my kids with me, and my kids restructuring that relationship, that broken relationship that I have with them, and my mother, and my grandparents as well. They're the main things in my life those relationships mean more to me than anything. So, but mostly my kids, just having them there with me, and figuring things out one day at a time. It's not going to happen overnight,
Right.
but one day at a time. Before I try to have everything happen like in one day, and I was so overwhelmed. I think that's what also led me to use and drink and stuff. But now I know that it's just one step at a time, one day at a time.
Okay.
It's gonna all work out.
And you mentioned treatment before that
Oh,
can
yes,
help you
absolutely.
too.
Yes.
Right. Andrea, then one of the things that just to kind of wrap it up, and I want to really suggest that you continue to talk to your counselor about these things, is you've got some ideas. You also seem to know the hurdles that you may have, and you're really clear about why you may choose to use. That it may be helping you to, it sounds like you've clearly said two things very strongly. It helps you to numb out, and yet the most important thing for you are these relationships.
Yes.
So I want to keep encouraging you to talk to your counselor about your plan, about how to continue to stay clean and sober, and dealing with some of the pain as it may reoccur. And I want to say thank you very much for your willingness to participate in this. And do you have any questions from me or anything that you want to say?
No, I just want to say thank you. I think this is a really good opportunity to get out there, and to the community as well as other women in here. There's so many women in here that come in and are coming down on drugs, and and don't get maybe some of them don't have the moral support that I have or that some of us do have. But there is a way to get sober, and there is just to stay sober. I think we should all. I think the Mosaic program is. I think everybody should go to it if we had the time.
I wish.
It would be great for everybody, and I think the treatment really does help.
Yes,
I really think it does.
I believe so too. Well, I certainly appreciate your time. Thank you so much.
Thank you for coming.